Hello, my name is Rochelle and I'm a registered qualified midwife. My role as a midwife is very diverse. I've worked in all areas of midwifery and my role consists of supporting all birthing people throughout the pregnancy continuum right up until the postnatal period or the 4th trimester period. I provide expert knowledge, I support them and I advocate on their behalf. So the first time that patients come in contact with maternity services is usually between 6 to 10 weeks. At this point, we will have a booking appointment. This is usually the longest appointment. It lasts for about an hour and it consists of us trying to gain a detailed history from the patient. So things like their medical history, mental health history, social support, any previous children that they've had. This all helps us to get a good picture of the patient and their background and help us to plan towards this current pregnancy. At this appointment, we will also take some baseline bloods to check for any conditions or any abnormalities, and this again will help us to plan towards the pregnancy. There will be a number of different appointments that will occur throughout the pregnancy period. So usually the next time I will see a patient will be around 16 weeks. You'll have another appointment at about 20 weeks. You'll then have another appointment at about 24, 25 weeks, then again at 28 weeks, 31 to 32 weeks, and then 2 weekly up until about 40 weeks. From 40 weeks, you'll have an appointment every week until you deliver your baby. All of these appointments are very important and they're important in their own right. At each appointment, we will give you the opportunity to ask any questions, to again gain any knowledge from us that you need to gain, ask questions, and also we will be doing different spot checks at each of these appointments. So at a bare minimum, we will be checking your urine, we'll be checking your blood pressure to check for any abnormalities. We'll also be potentially doing fundal height measurements to check that your baby's growing okay. We will listen into baby and your bloods will also be repeated at 28 weeks. In between all of these appointments, you will also have your scan appointments. So you'll have an early dating scan. This will be before the 16-week mark. You'll then have a 20-week anomaly scan, and this will be checking all the structures of baby to make sure that everything looks okay, all the organs are developing well and baby's growing well. And you may then also have a 3rd trimester scan. Again, this is just very much a benchmark and it varies from each pregnancy to each pregnancy. It also varies from patient to patient. So it very much depends. There will be some people that will need a lot more surveillance and they will have a lot more appointments and a lot more scans. And there will be some people who need a lot less surveillance. So they will see myself or the other healthcare professionals a lot less. Even though a lot of patients will obviously see me as a midwife, I don't work independently, so I work as a part of a multidisciplinary team. And so it may be necessary at times, depending on the circumstance and the pregnancy complexity again, to refer clients to other healthcare professionals, for example, a doctor, or to have an additional scan. So there's nothing to worry about if that does occur. And there should also be an explanation that comes along with that if you do need to have any additional input in your pregnancy. So as you can see, my role as a midwife is all encompassing. It includes so many different factors and the end goal is just to have a healthy birthing person and a healthy baby. And we help you to transition all the way throughout pregnancy into parenthood safely. So the word midwife means with woman. And although I do identify that not all birthing people do identify as being a woman, I do hope that everybody understands that we are here for you. Thank you.